Uh, Good afternoon, everybody.
Uh, Please, where is the park for those things?
Evening, good evening. It's such a pleasure to be here today. We have looked forward to this so much, and we're happy to be here today. My name is Fredlin Ifedolako, and for people who are actually in my cohort, you know that. Um, Please let me know you guys can hear me. Let me be sure that I'm very clearly. Good evening, everyone. Please, can I know that you can hear me?
Good evening, Freda. We can hear you. Your camera is off, Freda. Hello, Freda. We can hear you. I can no longer hear you. Can you hear me? Hello.
See me, you can hear me.
I can hear you. Yeah, we can hear
Hello,
you on YouTube.
good evening. Please let me know you can hear me.
Yes, we
All
can
right. Thank
hear
you so
you.
much. Okay. Okay. So I'm just going to start because we're already 5 minutes behind. Good evening, everyone. My name is Fredlin Ifedolako, and I'm the team lead for Lagos State um, SDSN Cohort 7. And it's such an honor to be here. Um, Today's conversation, our climate is our health, our climate, um, how is reshaping the well-being of Lagosians is more than just a topic. It's a reflection of the world we wake up every single day. And flooding isn't just about luxuries or every fall. It's about families that are displaced, communities cut off, and the health
Freda, your network is breaking. I don't know if you can move to a
impact.
place
We
where
are
the
here
network will
because
be smoother.
okay, please give me a second. Let me.
Yeah, no problem.
Please can you confirm I'm more audible?
Yes, please. Yes. Yeah, it's better now.
Okay, thank you. So I was saying that our conversation today, our health, our climate, how flooding is reshaping the well-being of the oceans, is more than just a topic. Actually, it's a reflection of the world we live in every single day. And flooding isn't just about blockage energies or heavy rainfall. It's about families that are displaced, communities that are cut off, and the health and the silent health crisis that follows afterwards. And as change makers, we are here because we believe Lagos can do better. And it starts with us, it starts with you, it starts with me, and it starts with every single one of us. with our ideas, collaboration, and our courage. This is a movement, one that begins with awareness, but must end in action. So today, we're not just going to be, we're actually going to be the conversation to awareness.
Further, your network is breaking and we can't hear you. I can't hear you. It's kind of breaking.
I the energies in the chat box. So if you're watching on YouTube, please let me see all your energies. I want to see love, I want to see likes. Okay, so meantime, I'm going to be calling up moderator. Exceptional, I'm going to be moderating from here. So going to exceptional John, are you here? Can you card him up, please? Let's have him on the call.
Yes, I am here. Good afternoon, Frenda. All right, that was an interesting opening welcome address by our team lead. That was a very, very interesting one. And we move straight up to I don't know, can somebody help me get reactions from the YouTube live? I want to interact with the people on YouTube. How do I do that now? I want to know where each and every one of us are joining from. What part of Lagos are you joining from? How is the flood? How did the flood affected your part of Lagos? And how do you manage to cope with that? Because of this meeting is timed and every session of the meeting is already timed, we are going to be moving straight up to our first keynote speech. Our first keynote speech will be delivered by Dr. Alexander Akigbe. He's a founder CEO of African Cleanup Initiative. And in a short moment, I'll be reading his bio. So run and go with me. Dr. Alexander Akigbe is the founder CEO of the African Cleanup Initiative, promoting environmental responsibility across Africa. He holds an honorary DBA from London Bridge Business School and has helped develop Nigeria's 2025 UN Sustainable Development Review. As the chairman of the Nigerian Civil Society SDG Strategy Group, he works under the office of the Senior Special Assistant to the President on SDGs. He was Nigeria's sole delegate in the US International Visitors Leadership Program on Climate Crisis. He leads Green Sustainable Solution, empowering communities through recycling and mentors entrepreneurs via Faith and Tony Elumelu Foundation. Dr. Akikbe organized cleanup efforts cleanup effort nationwide, hosted Africa cleanup conferences, and launched the Recycle Spay educational project, aligning school fees payments with recyclable recognized by CNN, BBC, and Al Jazeera. A UN Polak ambassador for peace and member of the ISWA, he holds certification in management and consulting and time management. As an accomplished author, he has written 4 books and earned over 55 leadership awards. Dr. Akigbe is happily married to Eunice and is blessed with kids. Can we please make welcome Dr. Alexander Akigbe? Dr. Alex, you have the floor now.
Okay, am I audible? Can you hear me?
Yes, we can. You're welcome, sir.
Dr. Alex, we can hear you. We can hear you. Please, I don't know if we can have your camera on.
Doctor?
Dr. Alex, in case you're talking, we can't hear you.
You cannot hear me.
Okay, okay, we can hear you now, Doctor.
Hello?
We can hear you now.
We can
Please,
hear
can
you
you have?
now.
The network is like breaking. It's my fluctuating or very clear at your end.
It's very clear now. You can go ahead, sir.
Okay, thank you very much for having me. I want to appreciate the host of this event. Thank you so much for putting up this conversation that is very, very important at this time. Yes, I have a very short slide, but I might not follow the slides back to back because of time. But the subject matter we are discussing this evening is something that is very, very dear to my heart because I have a kind of experience growing up. As I'm going to tell my story a little, I just want to speak from my heart now because I don't have all the time. And because I'm speaking to young people, I feel that to a large extent, everything that comes to us in
Doctor,
life,
we've stopped.
every reason about it. Sorry, call is trying to call me. Okay, so while growing up, I was one of those very, very fortunate people to live, well, I call it first time experience when it comes to flooding. At that time, while I was small, I didn't actually know what this flooding issue is all about. But later on, I just grew up to understand that there's nothing really I could do about it because I was born in Ajegule. I grew up in Ajegule. If you know Lagos very well, whenever that city or that part of Lagos is mentioned, you always have this feeling of, oh, that's those kind of people that live in those kind of underserved, you call it slum, you call it ghetto environment. And because I was born into a beautiful home where we all live in the kind of apartment you call face me, I face you. And so whenever it rains at that time, the flood will fill the entire street, get into our compound, flow into our house. And you will see, I can see have pictures on my head of how my mom will be carrying the pots, carrying the foam, trying to see what they can save from that whole episode of, will I call it, little flood, taking over the entire community at that particular time. And I never liked such kind of experience. I never liked it. But there was nothing I could do about it. I was just a child growing up in my father's house. I didn't have money to pack them, move them away from that vicinity. Even though I didn't like it, there was nothing I could do. So life just, you would say life happened to me at that level. And in fact, that experience is part of the thing that informed what I do today at African Cleanup Initiative. Because having undergo that kind of what I would call processing at that level, it changed a whole lot about my mindset. It changed a whole lot about how I see things generally. And one thing I said to myself at that time while growing up that if I have the opportunity to do something positively or to change the narrative, I think I would do something connecting to the environment. And as God will have it today, I work in the environmental space. I organize cleanups. I've been doing this for more than 15 years now. The first cleanup we ever did was done in Ajegule. Looking at the subject matter, how flooding is reshaping the well-being of Lagosians. Yes, a lot of us are being heated from the wrong side. like myself. The flooding did not come to me with a good image, with a good kind of view. It hit me differently, and I felt the impact so badly. And the only thing I could say to myself was, I'm going to be an agent of positive change going forward. You can move the slide now. Just keep moving the slide. I'm going to be an agent of positive change going forward. Because whether you like it or not, there's a need for us to have this understanding of the human impact beyond the water that you see. And if you look at Lagos State, for example, the populations of Lagos State alone, some people are saying more than 15 million, some are saying more than 17. In another research, I saw more than 20 million. So imagine this kind of number population living in Lagos. Whether you like it or not, some of us we experience this flooding issue based on where we are living, based on the location. I think recently, a few months back, we had about 60 stories of the ones that happened on the island in Lagos, how flooding dealt with some of them on the highland. Yes, and these things, at times, you sit down and you ask yourself, is there anything I can really do about all of this thing? And at times, when you ask yourself this question, one thing that comes to your mind, firstly, is the government's responsibility. And that is where some of us have missed it. Yes, the government have a part to play, but you and I also have a part to play when it comes to dealing with this issue, because we cannot leave everything for the government. And now flooding has now become, especially in Lagos, in some areas, a regular and worsening challenge. It's worsening because a lot of people have lost. The first international passport I did, the first one I ever did, what affected that passport was this issue of flooding. I don't know how the water flew into our house. There many years then, where I was living, got into my apartment, and the place I kept my file, before I could say Jack Robinson, that place was filled with water. Before I could pull out that document, I noticed that my face on that passport was virtually washed out. Not this digital passport we're using now. That old one that looks like paper, the face was virtually wiped off with water. If I tell you the pain I passed through to sort that thing, that particular thing took me to Abuja to go and rectify. Passport I got in Lagos. When it was time to fix that issue, I went to Abuja. It affected me. Flooding has affected me so badly that that's why you see me today. I do the work I do. We do a lot of cleanups in communities, schools, and we do it because we understand that you cannot wait for the government alone. Everybody will all have a part to play. And in Lagos State is all peculiar because the numbers alone, the population in Lagos, oh my God. Is it the poor drainage system? Some people, we used to have this idea back then, whenever it rains, for some people, whenever it's raining like this, it's always an opportunity for them to gather their waste together and take it into the so-called gutter, the drainage, and they'll just dump it inside. And they have this mindset that the water is taking the waste from point A and partially taking it to point B and taking it away from their community. That is the mindset some of us had when we were growing up, especially some of us that were born in Ajegule. But with time, we came to understand that these ways you see, they are not going anywhere. In computer, there's what we call garbage in, garbage out. You think it's leaving your face of your compound now. It's going to go and block somewhere. And the blockage, when it starts, the flood comes, it's going to send this thing back to you as a flood, or the waves will come back and hit you. And when it hits, it's going to hit you so badly that the outcome will not be pleasant. Climate change issue we are talking about today is another subject matter entirely on its own. A lot of people are saying climate change is a subject that to a large extent is caused by humans. And you might not prove them wrong. Because when you look at the way we manage our waste, number one, when we look at the way we relate with the environment, I tell people that the environment is God's gift. It's a gift from God to man. And how we deal with it, how we connect with it, how we relate with the environment, it's our own gift to fellow humans, to our communities, our own gift to our communities, our own gift to fellow human beings. But God has given it to us. But how you deal with it, we're going to determine the impact it's going to have on the next guy living in the next compound or in the next neighborhood, the next slide. And so it's important that we look at this subject matter from a whole, will I call it 360-degree kind of perspective, because whether we like it or not, the government have a part to play when it comes to flooding issues, because it has shaping a whole lot. Some of us have been forced to move from point A to point B because of flooding issues. Some of us have been forced to change circumstances, change the schools we attend, change the location, change the whole lot, because we cannot deal with the subject matter. And that is how tough this flooding issue can be. The next slide. And so it's important we look at it that instead of you waiting for the government to come and do something for you, you better start thinking what you can do for yourself, how you can change the narrative. Because this flooding we're talking
Dr. Alice, we can no longer hear you, sir.
can you hear me now? Can you hear me now?
Yes, yes, very good.
To the next slide, let me just round up. Move to the next slide. Let me just take it fast. Now, how is flooding reshaping Lagosians' well-being? I think I talked about initially your physical and environmental well-being. That one is number one. We've seen situations where I remember those days when we were very small. When it starts, when flooding issue happens to us like that in our neighborhood, I can still remember a situation. It's like I think an occasion back then where my mom had to take us away from our own compound to go and sleep in another person's house because we could not afford to sleep in our house. And that experience was not a pleasant one. But do I have a choice? So I think for me, another side we need to start looking at this conversation is what can we do differently? What can we do differently to reduce the whole impact of this flooding on humans? What can we do differently? Have you ever thought of it from that dimension? As little as an advocacy, yeah, I call it little because well, it depends on the angle you're looking at it. It might not cost so much for me. Just your voice, the word of your mouth alone can be a game changer for somebody. And that is why for us, it's not just looking at it, flooding. We ask ourselves, can we do something differently? How do you manage your waste? Let's even start from there. Because we're talking about the physical and environmental well-being. How do you manage your waste in your own house where you live? If you live in Lagos, there was a time where the Lagos state talked about waste segregation, sorting your waste from source. How many of us would take time to do all of that? And some of us grow up with this mentality that people that sort their waste from source, that they are poor people, or people that keep their pet bottles in one bag, put pure water sachet in one bag, they are hungry people. I don't know how we came about that kind of mindset. But for me, till tomorrow, in my house, I have a place I keep my bin. I have a place I keep my pure water sachet, and I have a place I keep my other waste. And the bin, the pure water sachet, the recyclables, the pet bottles, I give it to a recycler. And they give me something. If I had to empower one of my daughters to handle that side, as anything that comes in, that the money is for you. And she was so excited about it. Trying to build in her that consciousness that it's not everything you see out there that's a waste, and it can never be a waste until it's wasted. And I need you to understand that waste is a resource. It all depends on how you say it. The economic well-being, that alone, your status, your way of living, the cost of living, the thing, how you go about caring for yourself. I'm telling you, there are times when it rains so badly in a particular location, you find it very difficult for somebody to come outside. They will just stay indoor. I've seen it happen that when it rains in some location, they will stay indoor virtually from morning till when the whole water subsides. Imagine if you are going to do that, the time that runs business in that environment at that particular time, how will you survive? There are some shops, some stores in Lagos, some big shops. When it rains, it feeds the entire complex. Virtually all the shops will just shut down at that particular time. Nothing happens. All of these sites, they are not fun because it's going to affect your profit for that day. You're going to lose a whole lot. If you have a plan to do anything called business for that day, you virtually shut down. Do you want to look at it from the social point of view or the emotional? It's very, very bad. Very, very bad. The emotional part is not something you want to. In fact, I have seen, there was a time I was diving on the island. It rained so badly on that marina. The flooding was not here. Like, it was not funny. My car, the flood filled my car. Then I was riding a small Toyota Camry. It's virtually covered the entire bonnet. That car did not follow me back to the mainland. I live on the mainland. Because of that flooding that day, that car did not follow me back to the mainland. It got stuck at a particular point. I had to call my mechanic. Can you imagine the stress? It's not funny. I had to call my mechanic the next day to come and fix the car where we succeeded in parking the car because of flooding issue. And so if you look at all of these things, I think as young people, when I started our initiative far back at 2010, there was no support anywhere. There was no funding anywhere. I just grew up with this mindset, with this passion of doing something differently, because I know I've been hit by the issue of flooding while I was growing up. I know I've had first-time experience when it comes to relating, how people relate to the environment. And I just felt we can start a campaign. It was more like a campaign we started in 2010. But look at it today, we have gone past 15 years, non-stop. From this issue of dealing with the environment, we came up with what we call the Recycle Spray Project, how people can turn their PET bottles to exchange it for school fees. So we had to work with some low-income communities, and we tell the school owners, let's partner, let the parents bring PET bottles to the school. We convert it to the school fees of their child, and it was massive. If you type on Google, pay school fees to plastic bottles, you will see a lot about this initiative. It was covered by CNN, it was covered by BBC, it was covered by a whole lot. We came up with another solution again, recycle for pad, where we had to work with teenage girls in public and private schools. We go to the schools, we gather the PET bottles from them, and we give them pad to the girls in exchange for their bottles. We just did one, I think, October, yes, 2 weeks back or thereabout. These are solutions that we thought of bringing into, because when you look at the flooding issue, you ask yourself, what is actually the cost of this flooding? Because if you don't even know the cost, you might find it very difficult to come up with a solution. Because it's affecting the well-being of Lagosians, but what is responsible for it? Is it just the government alone that have a part to play in all of this conversation? So if you look at it, that the block drainage is one of the major issues. There was a time a video went viral of a particular location in Surulere where the canal was virtually blocked and filled up with PET bottles. And so for me, when I go out to functions and I see PET bottles around, what is coming to my mind is school fees. What is coming to my mind is pad. What is coming to my mind, money for that woman that wants to put into her business. And so I see it differently because of solution. So I think we need to develop this solution mentality. And so because if we don't reduce it, the impact, the cost of this whole issue of flooding in the community, then the host will be spending so much in trying to bring about solution. I don't even want to speak about adaptation at all, because it's going to be difficult for a whole lot of people to adapt to a flooding issue. Yes, you can mitigate it, you can prevent it, but adaptation for me is not the way a conversation. Because a whole lot is involved in that conversation. But we can choose to reduce the impact. We can choose to stop it. We can choose to be a voice. So that at the end, the children that are coming behind, the young ones that are coming, they will meet a community, an environment that is clean and healthy for everybody. Because at times you will notice in some places when it rains, it takes like 2 days for the water to finally go down. You ask yourself, why is it taking that long? Go to some other foreign nations. Once it rains, especially in seconds, in minutes, or an hour max, you see the whole place just dried up. But when it rains for like 2 days, water is still there. You ask yourself, why? What's stopping it from flowing? You look at the drainages, look at the structural design of that location. A whole lot put it, and now you want to call the government to before you hold the government accountable. For me, I ask myself, before you see me point hand to the government, I ask myself, what have I done? What have I done within my own space, within my own ability, before I start thinking about the government? I think if we look at the conversation from that dimension, we all will see that this subject matter, we all have a part to play. And as we put in our little efforts, we're going to see the impact positively on the other end. I want to thank you all for having me. I was meant to speak for 10 minutes. I don't know if I exceeded my 10 minutes, but my details are on the screen. You can send me a chat. You can send me an email, but don't call. and let's see how we can take the conversation further. Please bear with me. I just have to pull out myself from an event and do this. It's actually busy. This is my second, so this is my third event I'm attending to for today, and I have another one waiting again. So please bear with me if I have to pull out from this conversation now. Thank you guys, Ife, Gabriel, and the entire team for having me. I love you guys, and I hope we can have this some other time again. Thank you, and God bless you all.
Whoa, can we just put our virtual hands together for Dr. Alex? This was massive. Wow, wow, wow. That was a very, very, very brilliant presentation from Dr. Alex. And you can see the passion, the energy with which he was speaking. You would know that this is somebody that is passionate about change. And look at the powerful nugget he was dropping. It can never be a waste until it is wasted. Talking about waste, that really caught me. That really caught me. I want to say our reactions from YouTube. What are they saying, my people on YouTube? Yes, thank you so much, sir. We are grateful. Ajala Mubarak is saying thank you so much. Thank you so much. Praise is putting our hands together for you. Thank you so much. People on YouTube, please tell me, what do you learn from that session? What do you learn from that session? What is your take home from that session? Because that was powerful, very, very powerful. And one of the things I learned, one of the principles that stood out for me was when it talked about how the flood affected his residents in Ajegunle, and how that singular event changed his life forever. How that singular event brought out an energy in him that, hey, I'm not going to remain here. I'm not going to allow this thing pull me down. I'm going to find a way of preventing this from happening to other people. And you can see how what that has done to him. He has been able to feature on BBC, CNN, and that is what can happen if we will not allow our situations to to make us handicap, but that we can move forward. Yes, Vicky is saying, always ask yourself, what have I done from my end? Yes, it is a combined effort of the government and the citizens to make it work out. Very quickly, we'll be going for our second speaker. And if you have any question for Dr. Alex, please kindly drop your questions. They will be attended to. Please, I want to take note of that. All right, our second speaker is with us in the house, and this is a very, very highly respected man, Dr. Oludare Adeyemi. Dr. Oludare Adeyemi is a medical doctor and an occupational health physician with about 10 years of clinical and public health experience. He holds a master's degree in public health and a postgraduate diploma in family medicine. Currently serving as an occupational health physician, Dr. Oludare combines his medical expertise with strategic management skills to promote sustainable health solutions and systems improvements. His personal interest spans across environmental and occupational health, disaster preparedness, and intersection between climate change and population health. Dr. Oludare has been actively involved in community health promotion, workplace wellness, and public health education, with a particular focus on health system resilience in the face of environmental challenges. In his work, Dr. Oludare continues to advocate for the integration of sustainable health practices into public policy and community development framework, aligning closely with the United Nations Sustainable Development Goals, goal number 3, which is good health and well-being, and SDG 13, which is climate actions. Dear changemakers, can we please make welcome Dr. Oludare Adeyemi? Doctor, you have the floor, sir. Let's keep the applause coming. Let's keep the applause coming while we await our doctor.
Thank you so much.
You're welcome, Doctor. You have 15 minutes, sir.
Thank you so much. All right. Good evening, everyone. I trust our day has been fruitful and eventful. Right. My name is Oludare Adeyemi, as already introduced. I am particularly happy to be here and excited when I got the invitation for this conversation this evening. I was so excited because this is one of the things I'm passionate about. I mean, environmental sustainability, public health, anything about public health issue is what I am passionate about. And this particular topic is very, very germane and, is timely, especially because of the environmental changes that we're experiencing in Lagos, our health, our climate, how flooding is reshaping the well-being of Lagosians. So please, for a few minutes, let me just take us through some challenges that Lagosians have been facing and then what we will be doing about it and what the government should do. All right, so we all know that Lagos is a coastal megacity. The current statistics put Lagos at about 25 million people. And we know that Lagos is at the south, is facing the Atlantic Ocean. And Lagos is just about 2 to 6 meters above sea level. So that position of Lagos, very close to the sea level makes it a very vulnerable environment for flooding, right? Lagos has tropical monsoon climate with a distinct rainy season, almost from April to October, and a few period of dry season. So that also makes Lagos a peculiar city because of distinct rainy and dry season, and then especially heavy rainfall because of the climate condition. So Lagos is a peculiar city, and Lagos is there is an increasing urbanization. Unfortunately, poor planning of the government is there, and then also those issues about flooding every year has become a new norm, just like Dr. Alex has rightly put it. So all of these make Lagos to be very peculiar. Lagos is also a coastal megacity, and there is flooding almost every year. So it makes Lagos to become a very vulnerable state. Move on, please. All right, so what are the causes of this flooding? Why are we having flooding in Lagos? Like I already mentioned, heavy rainfall and rising sea level. Lagos is very close to sea level, and because of climate change and heavy rainfall that we cannot do anything about, we can't stop rain from falling, and we cannot stop the sea level from rising, especially because of the climate change that we're experiencing all over the world. So this makes Lagos to be prone to flooding. Poor waste management and block drainage. Dr. Alex did a fantastic job on that in his presentation. So this one has made citizens to have, we have work to do, especially as citizens, because when there is poor waste management, poor drainage, block drainage, this one has nothing to do with the government. It has a lot to do with the citizen. Like you rightly mentioned, I've also experienced situation where once it starts raining, especially in some locality like Ikorodu, Agege, Ajegunle, that he rightly mentioned, you see people, with joy, hurriedly carrying their waste bin and dumping everything into the gutter, into the drainage, into the canal. And they expect that, the flood will just wash everything away to any destination they care about. So this is an issue. Then, of course, rapid urbanization with poor planning. I was imagining that, look at it, some years back, Dubai was a desert region. If you have seen the picture of, you have seen the, you have seen the video of the Sahara Desert. Just bare land everywhere, dry, no few plants and a few trees that you see around. That was how Dubai was many years back. And then with planning of the government of Dubai, with technology in place, look at the transformation that Dubai has gone through. So I've been wondering that, we know, the government knows that we are close to the sea level. Lagos is flood prone community, or Lagos is a city that is flood prone because of so many factors we have mentioned. There should be proper planning from the government. Deforestation and coastal erosion, these are also other factors that bring about flooding annually in Lagos State. So there is almost nothing we can do about it. But on our part, like Dr. Alex rightly mentioned, we have a lot to do. We must take responsibility as citizens so that we manage our waste properly and make sure that you avoid dumping refuse, avoid dumping waste in the canal, right? Moving on. Next slide. So, what are the health impacts or health implication of flooding, which is where I am particularly concerned about? Of course, there are so many health implications. No. Previous slide, please. Previous slide, not this one. Yes. So, health impact of flooding. So, flooding, is actually, and it's something you don't want to experience too frequently, because if you have gone through flooding, if your community, your house has been flooded, you know what it means. It can be psychologically draining. So people who have experienced flooding have anxiety and depression. Mental stress and trauma, mental breakdown because of this issue of flooding. Imagine flooding, flood destroying so many things in the house, important things in the house, and people have to evacuate and go and be squatting with another neighbor in another community far away. It can be psychologically, traumatizing. So, and of course, people go through post-traumatic stress because of flooding, right? Physiologically, or in terms of health, we know that flooding can also predispose us to waterborne disease. Cholera, typhoid, hepatitis A are all can be on the increase as a result of flooding, because this particular disease, they spread because of water contamination. When a water body is contaminated and people come in contact with it, cholera can spread very rapidly. And cholera is a disease that you don't want. It's a notifiable disease, but you don't want any community to experience cholera because it can be very deadly, especially for the vulnerable demography like children. Children are vulnerable, elderly people, pregnant women are vulnerable, people that are living in some low socioeconomic communities like Ajegunle that Dr. Alex mentioned, Makoko, and other slum areas in Lagos. Those people are very vulnerable, and because of that, when they are affected with flooding, it is usually very devastating. Apart from that, illnesses like vector-borne diseases, there are some diseases we call vector-borne. Those are diseases that are transmitted through a vector like mosquito bite. And then that can include malaria, dengue fever. They can spread rapidly. As a matter of fact, in the recent time, in the last 3 months, we have seen increase in the treatment of malaria in the clinic. People are treating malaria over and over, and you'll be wondering, why are people treating malaria more than twice, 3 times within 1 or 2 months? It is as a result of the weather condition, the climate condition that we're experiencing, because mosquitoes are breeding faster because of water body stagnation and flood everywhere. And then people come down with frequent malaria fever. And of course, respiratory infection can also spread rapidly. from damp and moldy environments. That could also be physical injury, and as a matter of fact, death. We had a very sad story. Sometimes last year, a boy was caught up in one of the flood water in a particular community, and the boy could not be rescued. He got carried away by flood water, and that led to death of that boy. So flooding can be very devastating. So either it is before the flooding, we are exposed to that hazard, because of course, NEMA usually we want communities that are prone to flooding to begin to evacuate or begin to prepare for excessive rainfall. During the flooding, we see government coming into action, and even post-flooding, we are all exposed to this hazard at different time or the other. But in terms of health implication, it has mental health implication, it has physical health, especially infectious diseases, injuries, and death can result as a result of flooding. Next slide, please. So flooding is not just an environmental crisis, it is a public health emergency. It's not just an environmental problem, it is a public health emergency. Once there is flooding in any community, in any state, especially in a state like Lagos, it is a matter of public health importance. Next slide, please. It's a matter of public health importance, and as such, government and policymakers must rise up to the challenge and begin to intervene. Look at some peculiar cases of flooding in Lagos in 2023/2024. We experienced flooding incidents, especially in Lekki, in Ikorodu, in Surulere. You heard what Dr. Alex mentioned. I listened to his presentation, was quite apt. You heard what he said. Cars were submerged. Houses were, submerged inside flood. Beautiful houses, beautiful buildings were submerged in Lekki by the flood. Churches, as a matter of fact, just a few weeks ago, House on the Rock Church in Lekki was trending on the news that, was caught up in the flood and was completely submerged in the flood. And of course, we have the hospitals were overwhelmed with waterborne diseases that I mentioned before, cholera, hepatitis A, and so many other, infectious diseases that are spread by water contamination. We also had increased cases of malaria and diarrhea post-flooding. After the flooding, people started coming down with a lot of cases of diarrhea. Of course, when diarrhea starts, that is frequent stooling. It is as a result of contamination of water. Contamination of water, especially this flood water, when it becomes contaminated, it spreads to source of drinking water. And when drinking water becomes contaminated, we know the implication of that. So, flood is a disaster that we don't want to experience at all. Government must prepare, must take responsibility. Citizens must also take responsibility. If you look at the map that we are displaying in the slide, the map of Lagos, look at the red dot, is showing those red dots are actually flood-prone areas in Lagos. And this indicates that almost every part of Lagos is flood-prone without any area exempted. Of course, some areas are a little bit more prone than the other areas, especially Lagos Island, Victoria Island, Lekki, and so on. They are more prone to flood because of the environment, the water level, and all of that. And of course, because they are directly in contact with the Atlantic Ocean and the lagoon. So almost every part of Lagos is flood prone, and government must take responsibility. Citizens must stand up and help the government to make sure that we combat the effect of flooding. Next slide, please. So this topic that we are dealing with is very timely, and it has good implication on SDG. Of course, it has good connection with SDG 3, which is good health and well-being. It has connection with SDG 6, clean water and sanitation, SDG 11, sustainable cities and communities, and SDG 13, climate action. So this topic is very germane. Kudos to the organizers and the cohort that organized this conversation. It is very germane. We are dealing with important issues that affect the environment, and this is something that should happen very frequently. So climate resilience is earth resilience, and there is need for, we can see that this conversation we are having cut across a number of SDG. So meaning that there is need for collaboration, intersectoral collaboration or cross-sector collaboration. So Ministry of Health must collaborate with Ministry of Environment, right? And Ministry of Humanitarian, Ministry of Humanitarian and that deals with humanitarian actions must collaborate with Ministry of Health. So there is need for intersectoral collaboration and good resilience of our climate and our health status. Next slide. So how do we build a climate resilient health system? How do we strengthen our climate, our health system, so that, next slide, so that we can actually combat the effects of flooding? Next slide. So building climate resilient health system, what do we do? What can, what are the things that citizens can do, government should do? We must strengthen health infrastructure and there must be flood preparedness. Health infrastructure must be strengthened. Public health hospitals, starting with primary health centers, general hospitals, teaching hospitals, they must have, enough equipment. They must have enough doctors, enough, health personnel to work with when there are crises and outbreak. We all remember what happened during the COVID-19. It was a disaster for Nigeria, but we thank God that, we were able to come out of it, because a lot of people lost their life because we were not prepared for that kind of disaster. So there must be preparedness in terms of our health infrastructure and flood preparedness. Once we know that we are getting close to rainy season, and rainy season is coming, especially for flood-prone area, NEMA usually they give notice that, in the coming year, there's going to be more heavy downpour. Weather forecast will give us notification. So the government must prepare. Drainages must be cleaned up. One thing I've also observed that government must intervene and take action about is that sometimes when they claim to clear and clean these canals, you clean the canal and evacuate, the rubbish inside the canal beside the road. And for months, this particular refuse that you have evacuated out of the canal so that the canal can be free remain there. They will never be taken away to another place or evacuated. And of course, when rain starts falling, they will be washed back into the canal. So that must be looked into by the government. Early warning system and rapid response by NEMA, by the Meteorological Agency for Nigeria. As they give us warning system, the government must respond and prepare. If there are areas that must be evacuated, government needs to inform the communities and citizens that you must evacuate or you must prepare for flooding so that people can take action. We must also put in place climate-sensitive disease surveillance so that, if there is outbreak of diseases that are climate sensitive, like I mentioned, cholera, and then hepatitis A, malaria, dengue fever, and so many other ones, there must be, constant surveillance of this type of disease, and then proper actions are put into place. Public health education and community engagement, just like we are doing now, this is very good. We must continue to advocate and then continue to campaign for the public that this is what is happening. Lagos is prone to flooding. There is nothing we can do about it, but there is much we can do about it, because we can take action as citizens by making sure that we plant trees and then we don't throw refuse in the canal and in the drainage, and government also, take action. Next slide, please. So policymakers, healthcare professionals, citizens, all of us have work to do. All of us are responsible for taking action in terms of building climate resilience health system. Now, let's look at um, building climate resilient health system. I've also mentioned this. Next slide, next slide, next slide. Yes, so for individual and community, what are the actions that we can put in place? I started mentioning that we must start with proper waste disposal. You heard what Dr. Alex mentioned, and I really like that. So we must advocate. Maybe there should be another cohort that take action about this particular proper waste management or waste segregation, so that citizens will learn to segregate waste, so that nylon and then papers will not be put in the same container. You understand? So proper waste disposal, especially for citizens and communities, that must be put in place. Tree planting and green spaces, we need this. I think sometimes years back, Lagos State government started this tree planting campaign, and then all of a sudden the project was stopped. We no longer hear anything about it. But of course, we need to resuscitate this on our own. We must make sure that we plant trees. When the environment is green and we have plenty of trees around in the community, it actually helps to slow down flooding. Much of the flood water will be absorbed into the ground, and then flooding will be avoided. So volunteer for cleanup. That is Dr. Alex's area of expertise. We must volunteer for cleanup and do awareness drives, just like we are doing. We must do this regularly. We must support sustainable transport and energy. Government must give support, and we must also ensure that we do regular health education on post-flood hygiene. After flooding has happened, what do? We must teach children, we must teach citizens that proper hand washing is very important, proper cleaning, and then maintaining good environment. You must avoid the stagnant water, avoid damp area where mosquito can breed and cockroaches can breed faster. That we must educate our citizens. Very, very important. So climate action start with us. Every clean drain, every tree planted matters. It start with individual, it start with community, it start with the state, So we don't just put the whole blame on the government. This climate action that helps us to combat our health and combat flooding start with us. Everyone must take responsibility. Next slide, please. So in rounding up, a call to action, let's reimagine Lagos as a climate resilient city. Imagine Lagos being able to deal with and combat flooding, such that anytime there is heavy downpour, the water goes directly into the lagoon. Everywhere is dried up because there is proper drainage of any flooded water. We must also integrate health into climate policy. Health planning must be integrated into climate policy. So it's not enough. This year's United Nations General Assembly in New York, bulk of the conversation when I was listening was based on climate action, climate policy. But it's not enough to continue to make a lot of policies on climate change and climate action. It must be integrated with health planning. Health infrastructures must be put in place. That is the only way we can actually properly combat flooding and be able to overcome the menace. We must empower communities through this SDG-based advocacy, something that we are doing now. This is very important. So this advocacy we must spread this news. We must go into the communities and campaign, let people understand their role, the role they have to play in helping the government to combat flooding. We must let, especially vulnerable communities, like the Ajegule that Dr. Alex mentioned. We must go into this type of community, Makoko, areas, Oshodi, and Koshofe areas, and all those Alimosho areas that are very prone and slum area. We must go there and advocate. We must campaign that every one of us will have role to play in helping to combat flooding. And if we don't do something about flooding, if we don't act, flood will keep teaching us the hard way. If we don't act, flood will keep teaching us the hard way. So, guys, thank you very much. I hope we have been able to learn one or two things about our health, our climate, how flood is reshaping the well-being of Lagosians. Thank you, everyone.
Come on, can we please put our for Dr. Oludare? That was such a very, very self-explanatory and intelligent presentation. Come on, if we don't do something about this flooding, flooding will keep teaching us a lesson. Doctor, we are very grateful. We appreciate your time, and yes, thank you for doing justice to your presentation. And my people on YouTube are saying thank you, sir. Thank you, thank you. Darasimi is saying thank you, sir. The whole community is
Thank
saying
you.
thank you, sir. Yes, I want to know if there are any questions. If you have questions,
There are questions,
kindly start.
clarifications.
Okay,
You
please
can
go
take
ahead
that.
to read your questions. You can go ahead.
Who is asking the
Okay,
question? We
while
can't hear
it's,
anyone.
do
Or
you have
maybe
a
they should type
question?
it.
Yes, please type the question in the comment section so that we get them. While the questions are coming in, let me keep taking our reactions from YouTube. If we don't act against flood, flood will keep teaching us a lesson the hard way. Aisha Azan is saying awareness and community engagement is key. Rebecca is saying if we don't act, flood will keep teaching us the hard way. Guys, we are running against time. We are working with time. And so if you have any question you want to ask, please just ask your question. Nasir is saying, thank you, sir. In the absence of no question, I'll be handing over the microphone to our amazing team lead as she continues from this point. Are you there, team lead? Over to you, ma.
Hi everyone. Thank you so much. Please let me know you can hear me, please.
Yes, we can hear
Can you
you.
hear me?
We can hear you.
Thank you. I was at, thank you so much to Dari and Dr. Alex. It was so amazing having you both here. I think you both, I believe you both did justice to that, and I
Team lead, if you're speaking, we are struggling to hear you. Madam Team lead. Okay, I'll keep taking reactions from YouTube while our team lead sorts our network issues. Yes, sir. Adeyemi Kende is saying, yes, sir, we can't even use the water from our house after flood experience for months. That is amazing. Please let our reaction keep coming in, keep coming in. Kudrat is saying, what practical steps can communities, especially youth, take to support government efforts and raise awareness about flood preparedness? Dr. Oludari, that is a question, sir. I'll take it once again. What practical steps can communities, especially youth, take to support government efforts and raise awareness about flood preparedness? Thank you very much, sir.
All right, thank you very much. That's actually a very brilliant question. All right, so practical steps that communities can take, especially youth in the community, to support the effort of government and create awareness about flood preparedness. Of course, like we are doing now, this awareness campaign is one somewhere to start. So we need to, especially because of the peculiarity of the communities, so we must make use of every news media, especially in the language that people will understand, right? If it's a Yoruba speaking community, somebody must be able to speak in Yoruba language to them. Ẹ má da ìdọ̀tí sínú gọ́tà, ó máa fa wàhálà fún ìjọba. You understand? Something like that. If it's an Igbo speaking community, somebody must be able to speak in that language, you know. So awareness campaign, we can choose a day to go out en masse and then, you know, go with band and trumpet and then talk everywhere, choose a community or a location and do the campaign there. And of course, regular cleanup initiative that, like Dr. Alex mentioned, we can also do that. So when you do regular cleanup, you help government to evacuate, clog canals and gutters. We are indirectly informing the community and the citizen that when the gutters become clogged and blocked, there will be difficulty for the flood water to flow. And of course, it will flood will flow into anywhere that is available, especially the home. So to avoid flood in the homes and destruction of properties, we must clean up the canals and gutters, right? So especially before rainy season starts, that must be done. Then tree planting is also another thing that we can campaign about. Like I mentioned in my presentation, the government started that campaign some years back. I think it was this Babajide Sanwo-Olu's government that started that. I can't remember vividly, but I know they started tree planting initiative in Lagos State. Plant a tree. In fact, the news was, the advocacy was taken to schools, and then if you go to some secondary school now, you will see trees that are growing small because students were taught how to plant trees and how this tree planting everywhere can help to prevent flooding, right? And of course, we must also talk about reduction in deforestation and all of that. So these are some of the steps I think that we can take to help to assist the government in flood preparedness.
Thank you very much, Dr. Oludare. We have another question for you, and the question is this. With Lagos facing increasing flooding due to climate change, how can we integrate public health responses into climate action plans to protect vulnerable communities, especially women and children who often bear the greatest health risk? I'll take it once again, sir. With Lagos facing increasing flooding due to climate change, how can we integrate public health responses into climate action plans to protect vulnerable communities, especially women and children who often bear the greatest health risks? Over to you, sir.
Hmm. Thank you very much for that question. Women and children, of course, they are part of the vulnerable groups that are that easily are predisposed to this impact of flooding. Right? Of course, part of what we can inculcate is provision of health infrastructures is very important. But then, before we even talk about health infrastructures, important social amenities like there must be pipe-borne water or boreholes, right, for people in the in those communities. If there are good source of drinking water, source of cleaning water, people will not easily come down with contamination of contamination of water bodies by this flood. So something like boreholes, very important. And then of course, government can make sure that in those vulnerable communities, they make provision for primary health cares, and also make provision for health personnel to constantly be available so that if there is any outbreak or any emergency, there are personnel on ground to quickly rise up to the occasion and then sort patient out, right? So apart from that, there must be constant reminder, annual, like NEMA will always do, intimate us and remind us that rainy season is coming, and then we should begin to prepare. So that can so once we are moving towards leaving January, February, moving towards April, we know that rainy season is near. That is the time that we need to begin to clear our gutters, clear all the drainages around us, so that when rain starts, the flood can have proper channel, to go into the canals and back into the lagoon. So all of these are very important steps that we can take to integrate health actions into climate change. I hope that is clear.
Very clear, sir. Thank you so much, Dr. Oludare, for your time and for carefully distilling your topic to us. Now we are going to be listening for a very short period to one of our own from the cohort, Eferire Victoria. Eferire Victoria is a compassionate registered nurse, midwife, and dedicated public health advocate who believes that true leadership is measured by service to humanity. Currently serving at the Lagos State where she leads the president of Medical and Health CDS Group, Lagos Eastland Zone. Eferire's journey reflects courage, purpose, and a deep desire to make meaningful change wherever she finds herself. Her passion for Sustainable Development Goal 3, good health and well-being, inspires her to drive health-centered initiatives that empowers communities through knowledge, screening, and care. She is the visionary behind TENEV Health Markets Initiative, a remarkable project that brought free medical checkups, cancer awareness, and essential drug distribution to hundreds of people at the marketplace. Through this and many other efforts, she continues to bridge the gap between healthcare access and promote wellness at the grassroots level. I am, in her own words, the Luke 14:8 nurse. You're welcome, Eferire Victoria. Thank you.
Yeah, good evening, everyone. It's a privilege being here. I don't know if my voice is audible enough. Can everyone hear me?
Yeah, we can hear you. We can hear you.
Okay, thank you so much. First of all, I want to say a very big thank you to our cohort. Yeah, it's our cohort 7, the team lead, and every members. Thank you for the privilege to speak to us today. As earlier said, my name is Sojay, but I'm nicknamed Tenef. So it's not ENV, it's Tenef. That's my nickname. Um, I will be talking to us just briefly. Then afterward, the team lead said I should bring in a little game, which we are going to be playing at the same time. I want our full participation and attention. I don't have a slide prepared. It's just a few minutes talk. I just want to talk a little and probably putting more towards Dr. Oludari has said. He has said a lot. Being a doctor, I don't even know what I want to say that would be more better, right? But I want us to also to know that there is an intersection between health and environment. And when we say our health, our climate, is it's a it's a function of what we do. It's a function of the two of us coming together. I don't feel it's something as the first speaker said, it's not really like the government per se. It's us. We are the one that actually doing this. So I said that climate change is no longer a distant concept. It is here. It is around us. Only the fact that NYC brought me to Lagos literally made me see a lot about Lagos. I was the one that commented. I don't know if you guys saw my comment there that Lagos smells like Lagos have bad climate, like bad flooding. It's been a very I don't want to put bad experience within my 1 year of service here. It's not really been easy seeing the drainage and the flooding and all of that. And this made me see the impact of all of this on the health of people. The flood we now experience almost every rainy season are more than environmental inconvenience. They are growing to become a public health crisis. When flood water arise, they carry more debris. Of course, we know they carry a lot of dirty items, you know, and knowing all of this, we realize that um, a lot of people who are being admitted into our clinics thereabouts, they they come down with cholera, come down with typhoid, they come down with diarrhea disease. And if there's anything I used to tell my patients is that when they come and meet me that okay, they have malaria and typhoid, I'll tell them, do you know what typhoid actually means? Typhoid is more than maybe you are having headache and all of that. Typhoid is one of the big disease that affect our intestines. I start having abdominal pain, sharp pain. And if you really have typhoid, if truly you have typhoid, it's not something that you can even manage on your own with antibiotics and all of that. You actually need to be admitted. So these are heartbreaks that are very terrible. They follow every major flood. Families are being forced to drink contaminated water. You know, even sometimes here where I'm staying in Lagos, the water we have to like ensure we get quality water. It's very difficult. Iron spillage all over the water and all of that. And they are not statistics, so they are real people being affected, real lives being affected every day. And another kind of suffering, apart from all of these health impacts, is the mental and emotional toll. I can't imagine a mother who is actually like washing her home being washed away. I just imagine that kind of thing, or a family seeing their house being swept away, or sometimes, especially the Lagos and you can see all of this all of them carrying their traveling bag and all of that. So to me, I feel it's something we need to work together to do, just the way we are said. We must begin to treat climate change as an health issue. every policy, every urban planning decision, every environmental action must include an health lens. Like everything they are doing, even the waste management, they must look at the health perspective. We need to strengthen our community health education. We need to teach families on how to keep their water safe. As little as hand washing, as little as water hygiene, they go a long way. And as community, as Squad 7, we must use our voices. As nurses, as doctors, as citizens, as Lagosians, we must use our voices to demand cleaner environment, stronger emergency responses, and all of that. And I would like to conclude that our health cannot be separated from our environment. The air we breathe, the water we drink, the land we live on, they all form the foundation of our well-being. So when we are speaking of flooding in Lagos, we are not just talking about rising water levels, we are talking about rising health risk. And there is an urgent need for us to act on it. So let us continue to advocate, let us continue to educate, and let us continue to care. As a nurse perspective, I said, not only for our patients, but for the planet that sustains us all. Because in truth, our climate is our health, and protecting one means protecting the other. Thank you very much. Um,
That
so I have a
was
little,
short and impactful. Thank you so
yeah.
much, Nurse Efere Victoria. Thank you so much. I have a very quick announcement for the house. I want to encourage us to please fill the attendance. It is very important and it is very necessary that we do that right away. Thank you very much. Over to you, Madam Team Lead. We have less than 7 minutes to the end of this virtual advocacy, and I would like that we maximize the time left for us. So over to you, Madam Team Lead.
All right, can you hear me? Yes, can you
Very
hear me right
clearly,
now?
very clearly.
Okay. Thank you to everyone. Thank you, Madam Eferi Ray, for that powerful speech. And thank you to everyone who have joined so far. I am not sure if John had already mentioned that, but at this moment, we are currently taking attendance and we are taking screenshots of people on this call. Kindly drop your name, your full name on the chat board on on YouTube, because we are screenshotting right now. So let everybody who is on the call right now drop their name on the chat board. Thank you so much, John. You've done a wonderful job all along. And to round up, because this is we are rounding up, or we have come to the end of today's advocacy. Excuse me. But beyond just converging here to talk about what is going on in our society, there's the part where we are also taking responsibility for our community. So now that we are rounding up with our virtual advocacy, I want to officially introduce our state challenge, which is titled Operation Clean Up Lagos. And it is more than just a campaign, it is our collective commitment to act. So here's what we are doing as a team. We are we will be identifying key flood prone areas across Lagos and mobilize volunteers to help clear drainages, raise awareness, and promote community responsibility for cleaner environments. We are hoping we can get collaboration with important agencies to make this easier, especially with like Loma, so that when we are clearing, there's we have plan for everything. And I want you to know that every voice counts, every action matters. We're encouraging everyone here to not just watch, but for us also to participate. Please, let's talk about this in the next few days. There's going to be hashtag Operation Clean Up Lagos, hashtag our health, our climate, hashtag Lagos SDG Cohort 7, hashtag Change Makers in Action, which is going to be shared with everyone in the coming days. So before we close, I want to remind us of something simple but powerful. The first is nothing is a waste until you make it a waste. So whatever we see around us, that mindset, solution-oriented mindset, I think it is one of the most powerful things that Dr. Alex shared here today. So and it is actually the choice to care, the choice to act. the choice to believe that small hands can build a cleaner and healthier Lagos. See, flood may test us, so we know that, but our resilience will define us. And together as change makers, advocates, and everyday citizens, we are proving that hope is not a theory, it's a practice. So when we say we are open, it's because we are taking action. So after this session, I want you to go out there. I want you to talk about the climate. I want you to organize in your street. I want you to speak to people and tell them, no, pick up your dirt. It's not stopping here. It's going to block the drainage down the road. It's about how we are conscious of our environment and we are conscious of our future. So please, I want you to inspire us, because honestly, on a governor. So that brings us to the end of today's virtual advocacy. Please, I want to know if you are currently dropping your name on the YouTube group, because right now we're about to log out. Thank you to everyone who has joined so far, who have followed us till the end of this session. We're grateful to have you, and we're going to be having more and more and more sessions very, very soon. We're going to be meeting more like this moving forward. And please don't forget, there's a form that is pinned. That is that as you're dropping your name, please just also fill that. The reason is because that is the going to be like database, but for our reports we are going to be submitting screenshots. So please, I want you to please drop your name, please, please, praise David, please, screenshot, please, screenshot at this moment. So we have between now and the next 1 minute to drop our name, and whatever we take at this point is going to be our attendance. Thank you so much. Thank you, guys. Listen, we are we are about less than a minute to go. Less than a minute to go, guys. Thank you so much. Yeah, thank you, John. You did an exceptional job. I had to use your first name to compliment you. Thank you. Thank you to all our
Thank you
speakers once
so much,
again.
man.
You're welcome. Yes, please, let's drop our names, or drop your names, I'm also trying to drop my name right now. So John, if you can join, please drop your name too. Yep. So thank you, everyone. Bye. See you next episode.